ഹലോ ഫ്രണ്ട്സ്, പുതിയൊരു വീഡിയോയിലേക്ക് എല്ലാവർക്കും സ്വാഗതം. 1000 MCQ സീരീസിൻ്റെ പാർട്ട് 19 ആണിത്. ഇപ്പോൾ വീഡിയോയിലേക്ക് കടക്കാം. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, ഇമ്മ്യൂണൈസേഷൻ ഈസ് വിച്ച് ടൈപ്പ് ഓഫ് ലെവൽ ഓഫ് പ്രിവെൻഷൻ? ദ ഓപ്ഷൻസ് ആർ പ്രൈമറി, സെക്കൻഡറി, tertiary and all of the above. And the answer is primary prevention. Levels of prevention നോക്കാം. 4 level of prevention ആണ്. Primordial prevention, primary prevention, secondary prevention and tertiary prevention. First is primordial prevention, that including prevent emergence or development of risk factors. Second one is primary prevention, that is health promotion and specific protection ആണ് primary prevention. Then is secondary prevention, that is early diagnosis, prompt treatment and prevent complication. Last one is tertiary prevention, that is disability limitation and rehabilitation. This is all about levels of prevention. The next question, which of the following is the commonest cause of postpartum hemorrhage? The options are atonicity of uterus, blood coagulopathy, traumatic cause and none of the above. And the answer is atonicity of the uterus. The next question, hemorrhage occur within 24 hours following the birth of the baby is called. The options are primary hemorrhage, secondary hemorrhage, mixed hemorrhage and all of the above. And the answer is primary hemorrhage. അപ്പോൾ types of postpartum hemorrhage നോക്കാം. 2 types ആണ് mainly, primary and secondary. Primary including third stage hemorrhage and true postpartum hemorrhage. First one is primary hemorrhage, that is hemorrhage occur within 24 hours following the birth of the baby. ആദ്യത്തെ 24 ഹവറിനുള്ളിൽ ഹെമറേജ് ഉണ്ടെങ്കിൽ അതിനെ പ്രൈമറി ഹെമറേജ് എന്ന് വിളിക്കുന്നു. ദാറ്റ് ഇൻക്ലൂഡിംഗ് തേർഡ് സ്റ്റേജ് ഹെമറേജ്. ഫസ്റ്റ് വൺ ഈസ് തേർഡ് സ്റ്റേജ് ഹെമറേജ്, ദാറ്റ് ഈസ് ബ്ലീഡിംഗ് occur before expulsion of the placenta. And true postpartum hemorrhage means bleeding occur subsequent to the expulsion of placenta. Last one is secondary hemorrhage, that is hemorrhage occur beyond 24 hours and within puerperium. This is all about PPH. The next question, when placenta is not expelled out even 30 minutes after the birth of the baby, it is called. The options are Velamentous placenta, battledore placenta, circumvallate placenta and retained placenta. And the answer is retained placenta. Next question, collection of blood anywhere in the area between pelvic peritoneum and perineal skin is called. The options are tubal hematoma, pelvic hematocele, pelvic hematoma and tubal hematocele. And the answer is pelvic hematoma. In the next question, dissolution in the continuity of uterine wall at any time beyond 28 weeks of pregnancy is called. The options are rupture of uterus, gapping of uterus, covillary uterus and inversion of uterus. And the answer is rupture of uterus. In the next question, the medication most commonly used in the drug-associated psychiatric interview is. The options are diazepam, phenothiazine, amitriptyline and lorazepam. And the answer is lorazepam. The next question, which of these among Snyder's first rank symptoms? The options are thought insertion, somatic passivity, clouding of consciousness and hallucinations. And the answer is clouding of consciousness. Snyder's first rank symptoms of schizophrenia നോക്കാം. First one is auditory hallucinations, that is thought echo, second person hallucination, third person hallucination. Next is thought alienation, that is thought withdrawal, thought insertion and thought broadcasting. Next is made feelings, impulse or actions, that is may feel like hypnosis. Next is somatic passivity and last one is delusional perception. This is all about Snyder's first rank symptoms. The next question, relationship between the prevalence and incidence can be expressed as. The options are I is equal to P by D, P P is equal to I into D, D is equal to P into I, and none of the above. And the answer is P is equal to I into D, that is prevalence is equal to incidence into duration. The next question, Sullivan's index is, the options are expectation of life free of disability, expectation of life at birth, expectation of life at 1 year of age, and average life expectancy. And the answer is expectation of life free of disability. The next question, vitamin A prophylaxis to a child is, the options are health promotion, specific protection, primordial prevention, and secondary prevention. And the answer is specific protection. The next question, tip of iceberg phenomenon is mostly appropriately represented by, the options are malaria, measles, protein energy malnutrition, and rabies. And the answer is protein energy malnutrition, and the iceberg phenomenon is a situation in which a large percentage of a problem is subclinical, unreported or otherwise hidden from view. അതായത് ഒരു ഐസ് ക്യൂബ് വെള്ളത്തിലിടുന്ന പോലെയാണ് നമ്മുടെ ഐസ്ബർഗ് ഫിനോമിന എന്ന് പറയുന്നത്. അതായത് അതിൻ്റെ മോൾഭാഗം മാത്രമാണ് പൊങ്ങിക്കാണുന്നത്. അതുപോലെ തന്നെയാണ് പ്രോട്ടീൻ എനർജി മാൽന്യൂട്രീഷൻ്റെ കാര്യം. റിപ്പോർട്ട് ചെയ്യുന്നത് വളരെ കുറച്ച് കേസസ് ആയിരിക്കും. ദ നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ, കോർണർ സ്റ്റോൺ ഫോർ എ communicable diseases. The options are health education, rapid identification, treatment, and none of the above. And the answer is rapid identification. The next question, changes in occurrence of a disease over a long period of time is known as, the options are epidemics, seasonal trends, cyclical trends, and secular trends. And the answer is secular trends. In the next question, a carrier who gets infection from another carrier is known as, the options are incubatory carrier, paradoxical carrier, convalescent carrier, and pseudo carrier. And the answer is paradoxical carrier. In the next question, during bilateral electroconvulsive therapy, the electrodes are placed on, the options are biparietal region, bitemporal region, just above the frontal area, and occipital region. And the answer is bitemporal region. In the next question, which is the autoimmune disorder causes fibrotic changes in the connective tissue throughout the body? The options are carbuncles, pemphigus, systemic lupus erythematosus, and Scleroderma. And the answer is Scleroderma, that causes chronic hardening and tightening of the skin and connective tissues. In the next question, surgical removal of excess skin and periorbital fat from the upper and lower eyelid is known as, the options are dermabrasion, lipectomy, rhytidectomy, and blepharoplasty. And the answer is blepharoplasty. Remaining options would be, first one is dermabrasion. It is an exfoliation technique that uses a rotating instruments to remove the outer layer of the skin, usually on face. The next one is lipectomy, that is liposuction nu parayum. It's a type of fat removal procedure used in plastic surgery. Next one is rhytidectomy. It's also known as facelift. The tissue under the skin are tightened and excess facial and neck skin are excised. In the next question, erysipelas is caused by, the options are streptococcus, staphylococcus, pneumococcus, and Candida albicans. And the answer is streptococcus. Erysipelas caused by group A streptococcus. It's a skin infection. It's a form of cellulitis, but unlike cellulitis, which affect the deeper tissues. Erysipelas only affect the upper layer of the skin. Upper layer of the skin മാത്രമേ erysipelas affect ചെയ്യുന്നുള്ളൂ. ബട്ട് സെല്ലുലൈറ്റിസ് ഡീപ്പർ ടിഷ്യൂസിനെ അഫക്റ്റ് ചെയ്യുന്നുണ്ട്. നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ, ബിനൈൻ ട്യൂമർ ഓഫ് വെസ്റ്റിബുലാർ ഓർ അക്വസ്റ്റിക് നെർവീസ്. The options are acoustic neuroma, acoustic schwannoma, vestibuloma, and none of the above. And the answer is acoustic neuroma. അപ്പോൾ ഇത്രയാണ് ഇന്നത്തെ വീഡിയോ. അപ്പോൾ വീഡിയോ ഇഷ്ടമായെങ്കിൽ ലൈക്ക് ചെയ്യുക, ഷെയർ ചെയ്യുക, സബ്സ്ക്രൈബ് ചെയ്യുക. അടുത്ത പാർട്ട് വീഡിയോ ആയിട്ട് അടുത്ത ദിവസം കാണാം. താങ്ക് യു ഫോർ വാച്ചിങ്.